Hi, everyone. I was assigned the Mississippi Aphasia Screening Test, or the MAST, for my aphasia screening tool. So, the purpose and target population, this is supposed to be a very quick screening measure for severely impaired communication or language skills for individuals with an acquired brain injury like a stroke or a tumor. The target population, again, is intended for individuals with a significant brain injury due to trauma, and it's recommended for early recovery stages for primary testing, and then it can also be used as a retest for later on to see progress. This setting is awesome for early medical and rehab treatment, bedside evaluation, inpatient rehab, and serial assessment throughout the clinical course. So that test, retest. It's very quick, and since we're just bringing in a piece of paper, well, I'll get to the materials. But since we're just using limited materials, it's very easy to use it in an abundant of situations. The recommended age is 19 years and older. So the administration process. So this assessment, like I said, is very quick, 5 to 15 minutes. That can vary depending on the severity of the client. So the materials, like I was saying earlier, there's 9 subtests, and I'll have a picture of the MAST form on the next slide. But there's naming, automatic speech, repetition, yes, no accuracy, object recognition, following verbal instructions, reading instructions, verbal fluency, and writing/spelling to dictation. This test also requires 1 photograph, 5 common everyday objects like pen, keys, watch, and 5 written instructions on a different page. So each subtest has very specific prompts, like tell me what this is called. I am going to ask you some questions. I want you to answer with yes and no. And those are also on the sheet, so we don't have to like memorize those or carry a manual with us. They're just right on the form. Here's a picture of the front side of the aphasia screening test. Like you have the naming, the automatic speech. The repetition, there's also the other ones on the back, and that's also where the scoring is as well. So for scoring and interpretation, there's a total of 46 items. Each subtest is 10 points except for the yes, no, and that's 20 points. There's 2 index scores, which is the expressive and receptive language, and those are both worth 50 points. And this gives us a total score of 100 points, so it's very easy to score at the end and say basically you got a 96 out of 100, you are good to go. Or you got a 52 out of 100, which tells me you are moderately impaired. For the interpretation, obviously higher scores indicate better language performance, and the index scores and total scores allow for tracking of both expressive and receptive. So we can say, like, you do really good with receiving what I'm telling you and knowing what I'm saying, but your expressive is where I'm seeing some difficulties. The psychometrics of this test is the validity. Left hemisphere stroke patients scored significantly lower than right hemisphere or the control groups. And there was strong correlations with the Boston naming test and the token test, which are 2 other great screening tools. The reliability in the English version and in other languages, the test reliability over 7 days, over approximately 7 days, was awesome for both expressive and receptive uh, measures. The normative data, this was based on sample size, small samples with mean totals of 9.5 controls, 47.2 left hemisphere, and 75.2 right hemisphere. Strengths and limitations. Strengths, it's fast and it's easy to administer. It's sensitive to severe aphasia and it captures both receptive and expressive language. We can also use this to monitor progress over time. The limitations, the normative data and reliability data are limited, even though there is information, but there could be more stronger. information for this. There is some subtests like the object recognition that could be affected by non-language factors. And clinical considerations. It's free. There's no formal certification. There's two alternate forms, excuse me, in development, and it's specifically designed for adults with acquired brain injury. So we're right on the dot with aphasia, which is atypical. Thank you.